Hello, class. We are going to learn about spinal cord anatomy. So this demo is for spinal cord anatomy. As you may know, at this point, nervous system is divided into two branches, CNS, central nervous system, and PNS, peripheral nervous system. CNS comprises of spinal cord plus brain. PNS comprises of everything else. Primarily, when you say everything else, what else is there? Mostly nerves. There are two types of nerves based on where they're emerging from. Spinal nerves and cranial nerves. So this demo is for spinal cord. So here, you're looking at spinal cord here. Spinal cord, as you know, it runs from within the vertebral column, runs from C1 to the level of L1 or L2, lumbar 1 or lumbar 2. Spinal cord does not extend all the way to the sacrum, except for in little children. As we grow up, by the time we reach adulthood, basically our vertebral column lengthens as our bones grow. However, beyond the age of 2.5 to 3, approximately 3, spinal cord, central nervous system, and nervous system, period, nervous system stops growing. You can assume that after the age of 4, there is no further growth of the nervous system. So as we keep going taller and taller, our spinal cord recedes from sacrum to the level of lumbar. So this is where you will see in adult. From C1, cervical 1 to lumbar 1 or lumbar 2. So this is what spinal cord looks like, extracted out of the vertebral column. This is what we are looking at. These are spinal nerves. Okay, these two, here and here. And as you can see, the spinal nerve has two different roots. These roots are dorsal and ventral. We'll talk about those. This is dorsal root of the spinal cord. And this, as well as this or this will be considered the ventral root of the spinal cord. Superiorly, you see the same thing again. This is spinal cord. All of this, these are spinal nerves. These are the dorsal roots of the spinal nerve, while these, which don't have that swelling, that bulge, are the ventral roots. Okay. Within the vertebral column, spinal cord comes with its own protective layers. Those protective layers of spinal cords, you can also refer to those as meninges. Meninges are divided into 3 separate layers of tissue. Dura mater, arachnoid mater, and pia mater. Dura mater, arachnoid mater, pia mater. Between dura and arachnoid, there is a space. Refer to that as subdural space. So basically, this is most external, and this is most internal. We are going from out to in. So let's say your goal is to lay your probe or rest your probe on the body of the spinal cord, you'll have to first open the vertebral column. Then you will encounter the dural sac, dura mater. Cut that open. The inner lining of that dura mater is the arachnoid mater. So these two are actually together. Between arachnoid mater and pia mater, there is another space that we call subarachnoid space. Okay, so these are the meninges, sometimes also called meningeal layers. So let's take a look at this. Let me see if I can make this. Okay. So here we are looking at a section of the spinal cord within a vertebra. As you can see, this is the spinous process. As I said, your goal is to lay your probe on the body of the spinal cord. So if you open up the spinous process, let's say you cut open the spinous process, first you will encounter what's called epidural space. Epidural space. Where is the epidural space? Here. Filled with fat and connective tissue. This is epidural space. This epidural space basically is a space that's filled with buffering substances like fat and connective tissue that's present between the bone and the meningeal dura. So beyond the epidural space, let's say we magnify this a little more. Okay, you can see the epidural space here. Meningeal dura. The reason why I'm calling this meningeal dura, because there is a endosteal dura, which is present for bone, not for spinal cord. So right here, this is the meningeal dura, this layer. Okay. Where is the subdural space? Subdural space, let's magnify further. Subdural space is here. I'm using a different color right there, what I'm tracing. You can see this is like a little yellow color here. See that? That is subdural space. Subdural space is like plays the role of a pocket, just like your pocket is collapsed and it has nothing, unless you put something in there. You put your key or wallet in your pocket swells up. You know, it has substance in it, it inflates. Similarly, this subdural space here normally stays collapsed, which is why it's looking so small. If fluid deposits within that subdural space, it will inflate. So right here, this layer, this is dura, or call it meningeal dura. And here is the subdural space. And like I said, arachnoid and dura coexist, they're together. One is outer, one is inner. Just like if you touch the outer part of your palm, outer skin of your palm, and inner skin of your palm, they feel different, but they are together. Similarly, dura and arachnoid are together. Where is the arachnoid mater? Right there, this layer. This is arachnoid mater. Below that, this space, this is subarachnoid space. So once again, here, this space, subarachnoid space. What is this filled with? It's filled with a fluid known as cerebrospinal fluid, abbreviated as CSF. Cerebrospinal fluid, CSF, right there. So epidural space, dura mater, subdural space, arachnoid mater, and this is subarachnoid space filled with cerebrospinal fluid. And stuck to the body of the spinal cord right here, this light blue layer that you see, this is what we call pia mater. So in order to lay your probe, let me back up here. In order to lay your probe, you have to cut this open. You have to remove the fat. You have to cut the dural sac, which is dura on the outside, arachnoid on the inside. You have to wipe away the cerebrospinal fluid. Even then, you can't lay your probe directly on the spinal cord. It will be on the pia. Pia is so tightly stuck over the body of the spinal cord tissue that you can't remove it. You have to use like a needle or something and little by little remove some of the pia. It's that tightly stuck. So let's look at the spinal cord itself. When we're looking at the spinal cord, you can clearly see that there is white matter and there is gray matter. Gray matter takes the shape of a butterfly or the English letter H. Okay. So let's first name the gray matter. Right in the middle, this is what we refer to as central canal. Central canal also has cerebrospinal fluid within, circulating within that. Okay. So now, this gray matter is called or referred to as column, etc., commissure, etc. So based on where it is, horn, commissure, column, etc. Okay, so first let's figure out what's anterior and what is posterior. Why do we call some of this anterior gray horn, posterior gray horn, lateral gray horn? Before we start naming those, we need to know the anterior versus posterior. The easiest way to remember the anterior versus posterior is going by this dorsal root and ventral root that we talked about before. Dorsal root, ventral root. Another way will be to focus on the spinal cord and look at this, erase some of this, look at these folds in the middle. These folds right there. So as we know, or we may not know, folds within the tissue is referred to as sulcus, and deeper folds are called fissure. So this will be a sulcus. This will be, as you can see, this is deeper. This will be a fissure. Going back, look at that. Dorsal, meaning that's the posterior. This is ventral, meaning this is the anterior. So appropriately, this deeper line, deeper groove, refer to that as anterior, change the color, anterior median fissure. anterior median fissure. What would we call this one then? Shallow groove. Appropriately, posterior median sulcus. So anterior median fissure, posterior median sulcus. If you remember the fissure and sulcus, fissure is anterior, sulcus is posterior. That's another way of learning which one is anterior, which one is posterior. You want to learn both. One going by the root, another is going by the fissure and sulcus. So going back to here, when you can't see the root, you can still see the fissure and sulcus. So posterior median sulcus, anterior median fissure. Okay, so now that we know this is anterior, this is posterior, guess what we call this? Posterior gray horn. Horns. This and this. And so, what would we call this? Anterior gray horns. And what do you think we'll call this? Appropriately, let me change the color here. Lateral gray horn. Right and left. So posterior gray horns, anterior gray horns, lateral gray horns. What do we call this bridge? This bridge is referred to as gray commissure. All of that. In the middle of the gray commissure, right there, as we learned before, central canal. The central canal also contains CSF, cerebrospinal fluid. Okay. Now the white matter, that's for the gray matter. For the white matter, what do we have for the white matter? Well, similar, same type of nomenclature, naming system. Posterior, this is posterior, this is anterior. So we call this posterior white column. Posterior white column. Similarly, this will be anterior white column, and this will be lateral white column, both this and this. Posterior white column, anterior white column, lateral white column. Posterior gray horn, anterior gray horn, lateral gray horn, gray commissure, central canal. Pia mater, subarachnoid space, arachnoid mater, subdural space, dura mater, epidural space. So once again, this is the dorsal root, this is the ventral root. This whole thing is a dorsal root All of that is dorsal root. Especially this bulging is called dorsal root ganglion. The term ganglion, basically a ganglion is group of cell bodies within PNS. Group of cell bodies of neuron within the PNS. So this is dorsal root ganglion. As you can see, the ventral root, which is all of this. This is only ventral root. There is no ganglion. There is no bulge. Dorsal root ganglion, ventral root. Same thing. This is still the dorsal root ganglion. This is the ventral root. The difference is that here is covered by connective tissue. Basically, this is going to be nerve. So it's not just pia, not just dura, it's covered by meningeal layer and connective tissue. Nerves are covered by connective tissue. So these are also encased within connective tissue. That's why this looks different in color than this. This is where the connective tissue has been exposed, and here the connective tissue is very much present. Basically, the dura mater extends all throughout the root. This is all dura mater. Okay, so this is just to show you again. Here is the root, epidural space, the same, dura, pia, etc. So basically, you can transfer this into these models, what we just learned. You can see the dorsal root, meaning this will be posterior gray horn, anterior gray horn, lateral gray horns, posterior gray horn, posterior gray horns, anterior gray horn, lateral gray horn. This is the ventral root. Same thing, anterior white column, lateral white column, posterior white column. This is gray commissure. Basically everything that we learned before, and you can see the dorsal root, ganglion, ventral root, posterior white column, lateral white column, anterior white column, posterior gray horn, lateral gray horn, anterior gray horn. You can see the posterior median sulcus, anterior median fissure. You can basically transfer everything that we learned. Okay, now take a look at the whole spinal cord. Right here, this is the whole spinal cord. Let's magnify that. Spinal nerve, there are 31 pairs of spinal nerves. And often there are 4 places in the body. These spinal nerves are actually crisscrossing, they're interpiercing and going in different directions. Where they are exiting and forming a cluster, those clusters are given names and they are called plexus. A cluster of nerves together referred to as plexus. So what you are looking at here, this is what we call cervical plexus. What you are seeing here and here, use a different color, here and here, these are known as brachial plexus. Cervical plexus, brachial plexus. Do we have a lumbar and sacral plexus? Of course. Right there. This is lumbar plexus. And here, sacral plexus. So brachial plexus, cervical plexus, lumbar plexus, sacral plexus, groups of nerves together. Something else here. Spinal cord stops at the level of L1 or L2, as you can see right there, the end of the spinal cord. This end of the spinal cord, refer to this as conus medullaris. Conus medullaris. This conical, this. And look at this group of spinal nerves that are exiting like the tail of a horse. This whole group of spinal nerves that are exiting as tail of the horse is continuing on. This is what we refer to as cauda equina. Basically, with spinal nerves, as you can see, the spinal nerves are exiting on either side, one on left, one on right. So all the way through cervical, through the thoracic area and the level of L1. These nerves are all exiting in pairs. But beyond the level of L1 or L2, there is spinal cord basically stops. So all the remaining lumbar nerves and sacral nerves exit the spinal cord as a group together that looks like the horse's tail. And that's what we call cauda equina. These are nothing but lumbar and sacral nerves. Okay, and there is conus medullari. Now this is for you to study. So that's pretty much completes that spinal cord demo here.